Here at Diabetes Care Group, we have 9 out of 10 patients achieve some type of meaningful result with their diabetes. So our campaign is Be One of the 9, because we want people to come in and be one of the 9 out of 10 patients that realize results. And most of those patients get results within the first 3 to 6 months.
So at Diabetes Care Group, they have a team approach, whether it's a nurse practitioner or a physician and the pharmacist and the certified diabetes educator. They kind of team approach the patient, and all of them interview the patient, sometimes together, sometimes separately, and develop a plan, a cohesive plan among the 3 or 4 of them, and then enact that plan.
Because when you bring in dietitians and nurses and pharmacists and physicians and nurse practitioners, you get different perspectives. You can change medications and it takes 5 minutes, but to really sit down and spend time talking to the patients, really focusing on what their specific problem is. So if it's food, sit down and talk to them about food. Make sure the patients understand the information you're giving them.
9 out of 10 of our patients achieve A1C goal within the first 3 months. We see it. We see patients that come in, have A1Cs 8, 9, 12, 14, whatever it may be. So when you see them, 6.5, 6.9, I feel better.
When the patients have that meaningful drop, we've started giving them the bracelet and saying, here, because you're one of the 9. The patients are just going wild over it. They're like, well, I'm going to put this in my truck and so goes here, but they don't have a bracelet.
There's one patient who's one of my babies, and she initially started the project and was very non-compliant, unfortunately, A1C over 14, and we brought her A1C down significantly. It was in the 7 range in, I think, between 3 to 6 months. So she made huge strides.
Having a pharmacist here is wonderful. You've got folks that understand these drugs very, very well. We ask all sorts of questions about interactions between other drugs. We've got patients here that are on antivirals for various reasons, and it's nice to have a go-to person to investigate how those drugs may interact with other drugs. It's a time saver, definitely, and it really helps us learn the drugs even better and the power dynamics behind them.
So they've developed relationships with the patients just as we have, I think it's a lot about making that connection and just having that additional support.
Courtney, she'll have me bring in all my meds, and she'll look everything up on the internet and see if there's something new that maybe I should be taking, or if one of the pills might interact with another pill. So she's on top of all of that, which I never felt like they really were at the family doctor.